Well, ladies and gentlemen, very warm welcome to eCancer's 5 Minutes With. And it's an incredible pleasure today to welcome a friend and a great global cancer researcher, Dr. Ophira Ginsburg, who is right now a visiting researcher at the World Health Organization's International Agency for Research on Cancer. She's also a consultant medical oncologist, and as many will know, a really world-famous global oncology researcher, particularly on women's cancers. Huge pleasure to have you with us, Ophira. Warm welcome. And we're here today to really talk about your co-leadership of a fantastic new commission, the Lancet Commission on Women and Cancer. We're going to hear a little bit more about that in a moment, but let me dive first in with my first question, which is, tell us a little bit more about the history leading up to this important commission over the last few years.
Thanks so much, Richard. And first, it's my pleasure to be here and to do this short video with eCancer. The Commission has an interesting history. In fact, it's about 5 years now that we published the Lancet series called Health, Equity, and Women's Cancers. You were very much involved in that, and many colleagues around the world contributed to this 3-part series that drew attention to the untold story, really, around why so many women have been experiencing breast cancer, dying of breast or cervical cancer, as 2 marker cancers to highlight the gross inequities globally for women seeking healthcare for cancer and for opportunities to prevent cancer, like in the case of cervical cancer. We asked some important questions in that series. We had some policy recommendations, but what led to the commission really was an understanding as we came together that a lot of these questions had never been really addressed before, such as the impact to societies, the impact on poverty. What happens to the children of women who die of breast or cervical cancer? That, together with Professor Anna Langer's Lancet Commission on Women and Health, the "and" being key, really got us thinking around the interaction of women and cancer that goes beyond cancer that women develop, or really even a biomedical perspective on cancer.
So this was a really important milestone in the series, and obviously it set you up really well for thinking around this new major commission, Lancet Commission, which is many of our readers will probably be listeners will be familiar with, is a really major undertaking. Tell us a little bit more about this Lancet Commission now. What stage you're at, what are the sort of preliminary findings, and then give us a sense of when we might be expecting to see it come out.
Right. So I'll start with the exciting part first, which is expecting to have a publication, a major report in the Lancet, March 8th. That's International Women's Day of 2023, which sounds like it's a long way off, but you and I both know, being involved in such commissions, it's going to come up fast. And we're working very hard now on the research, asking the questions and trying to address with some really solid empirical findings, such as what I'm doing here as senior visiting scientist at IARC. The Commission's remit is to take an intersectional feminist approach to cancer, which may surprise some people listening to this. What does that mean? Really, it's not about women being the only important gender on the planet or any such thing. It's a way of getting at social inequalities that impact cancer risk and cancer outcomes for people of all genders, right? And so the key questions we're going to address are the preventable and premature avertable mortality for cancer in women. There's a lot of cancer risk that hasn't really been unpacked in terms of sex or gender. We're also going to take a more feminist approach to the economics of cancer. So we're going to look at more, what are the true costs that haven't been captured that impact families and societies if a woman does develop cancer. And this is not, we're not going to miss the opportunity to say something about gender inequities in the cancer healthcare workforce.
Great. That's really great. And I think maybe, again, for people listening to this as well, there's a fantastic new website that you put together with a lot of details, also describing all the commissioners, an extraordinary range and depth of commissioners in terms of multidisciplinarity. I mean, it really is a global collaboration. And I guess maybe springboarding on that, and I don't want to sort of spoil what we're going to be reading in 2023, but I wonder if I could just ask you to give you some reflections of where you think women's health and cancers are going to be going in the, I use the word notionally, post-COVID pandemic world. What's the sense you have of what the major challenges are going to be into 2022 and 2023 and beyond now for women with cancer?
That's a great question. I guess I'd start by saying I would be remiss if I didn't acknowledge the fact that cancer and cancers are just one major health issue that impact women in so many ways, myriad ways, and that women and also persons that are gender minority and otherwise marginalized populations are the same individuals and communities that are most impacted by any catastrophic event, whether it's man-made or otherwise. We're now in the middle still, I would say, of this pandemic. We also have to address the issues regarding climate change. And I understand that some of you and your colleagues are looking into conflict and climate and health. These are incredibly important priorities. I'm concerned that women's cancers or cancer and women can be a missed opportunity to help improve our approach and be more creative, looking at the empirical evidence of what works, looking at investment cases and returns on investment in health in general. Please, for those of you out there who are non-cancer experts, use us in order to make the case for investing in health more broadly, including in public health.
No, that's an absolute wonderful ending, because I think you're absolutely spot on here. There's a tendency here to just focus on elimination of cancer cervix. We know full well there are many other cancers impacting women's health. And of course, you said you situated it beautifully within the sort of wider women's health agenda. 2023 is when the report's going to be coming out. I know there's going to be lots of other work being done and published between now and then. You've got a fantastic new website, which I really thoroughly recommend people go and have a look at. Thank you for offering to engage with the wider community, particularly major policymakers. I know the door is very much open as a commission to be able to advise individual organizations and individual countries, and indeed research groups as well. Dr. Ophira Ginsburg, at IARC, thank you so much for giving your time today, your 5 minutes to talk about this fantastically important commission and your wonderful work. Thank you.
Thank you so much.